Good evening, everyone, and welcome to another event hosted by the Cyprus Medical Society of the UK. I'm very delighted to be joined by my colleague at the CMS UK, co-president Savvas Hadjiphilippou. Today's discussion, we will meet Dr. Nicholas Andreou. In many ways, Nicholas is like some of us. He completed his military service in Cyprus and moved to London to study medicine at Imperial College, where he graduated in 2014. But he's not like some of us. In addition to his medical studies, he completed a degree in healthcare management at the Imperial College Business School. During his early years at medical school, he set up CYMedNet to help improve Cypriot students to enter into UK medical schools. Indeed, many of today's young Cypriot doctors have received some sort of training from CYMedNet when they were applying to join the medical school. Upon graduating from Imperial, he was selected to join the academic foundation program, where he researched the cost of the legacy recruitment practices in the NHS. As such, in between his shifts in the emergency department, he taught himself product design and developed the blueprints for the Locum's Nest app. He's now transitioned fully from being a frontline doctor into the world of social impact entrepreneurship.
Locum's Nest, for those that don't know it already, is a platform that matches vacant shifts in healthcare organizations to doctors, nurses, and other healthcare professionals. The Telegraph has named it as one of the top 5 ideas to save the NHS and was regarded as one of the fastest growing companies in Europe by the Financial Times. Locum's Nest is responsible for improving the working lives of over 50,000 healthcare professionals and for saving the NHS over £500 million to date. Nicholas, welcome and thanks for joining us this evening.
Thank you for having me. It's a huge honor and pleasure to be here.
Let me kick things off and say that from your biography, it's very obvious that you always had an interest in management and entrepreneurship. Did you know since medical school that you would follow a career outside of clinical medicine?
It's a good question. The honest answer, I had no clue. No. It's one of those things that just creeps up on you. You have an idea, and then you start, thinking about it more and more, and then you fall into it in some way or another. So no, I mean, I was always the kind of medical student or medic that didn't really have a preset idea of what I wanted to do with my career. So, when this came up, it was almost like it just rolled over and happened.
In many ways, that's quite unusual, but also typical of a medical student who either knows exactly what they want to do or ends up being very creative and going down a completely different path. I think the question on everyone's mind is, how did you come up with the idea of Locum's Nest?
Yeah, so it all started back in 2014 or 15. I was in a South London hospital, very understaffed, like most are. I won't name the hospital, but I was working on a gastro ward, and we were just scrambling. I was the F1 back then. I was scrambling to find a cover, and the rota coordinators, poor them, were also just calling, texting. The story that is ongoing even today. It was the same back then. But I got talking to a few of the staff that would be eventually found, a few of the locum doctors, and they weren't happy with the process. It was all done last minute, really ad hoc. The rota planners themselves weren't happy with the process. And then I moved to my academic foundation year, where I was fortunate enough to research the project a little bit. So we sent freedom of information requests to that was 2015, 2016, freedom of information requests to every hospital in the country, asking them how much are they spending on agencies. Agencies are the recruitment middle person or organization that would say to a hospital, you have a gap, I have a candidate, bringing the two together. but actually that was very expensive. It was something like a £4 billion expense, the agency fees, which is enormous. It's it's astronomical in some circumstances. So we thought, okay, hang on a minute. I mean, you have these overqualified doctors that are, very tightly regulated by the GMC. You have the hospitals, which are also public bodies, well recognized. Why can't the two talk to each other? And like any young doctor or nurse, I'm sure, what if there was an app type thing that, what if there was an app that would allow you to book your shifts just like you book your yoga class, or, something similar? Or, back then Uber was about to start as well. And Savvas, I'll be honest, I don't entirely remember the decision point to start this, other than I was in Larnaca with a close friend of mine and now business partner Ahmed, and I was pitching the idea, and then a few months later we were like, okay, what are we going to do for our F3? We said, might as well start this. So we gave it a go, and the rest is history, really. Yeah.
Did you, it sounds like a very idyllic story, sort of the typical, I'd expect nothing less really of such a great idea. Did you have anyone who was already established doing this? Did you have someone who was already, that you were up against?
No, not really. I mean, back then you have the knowledge of your little ward, your little hospital, you have this idea and you're like, oh yeah, what's out there? And then you do a bit of research and there's nothing really there, or nothing well established. So back then we were lucky enough that we had the idea, developed it, costed it, designed it, and ready when the then health secretary made it his agenda, his personal agenda, to cut massively agency costs. And so we were at the right, serendipity makes a huge difference. We're at the right place at the right time to almost create the market. Now the market has a few more around, but back then it was us against agencies.
And what did you talk about creating and designing thing? What did it take? I mean, did you have to learn to code? Did you get someone to do it for you? Did you? How did it all start? There were only two of you.
Yeah, it was a very good question, because we had the same question back then. And so it was foolishly, we spent something like £500 on a weekend coding course, and then we soon realized that that wasn't going to be the way forward. But what I did teach myself was app design, and that's now, again, back then is a lot of foolish and being foolish and naive, but now it's a very specialist area, mobile app design. But back then, I thought I had taught myself well enough to start, and actually it was, the first prototype was good enough to start. We set some money aside, both of us, and just procured this piece of work. After that, then you have to do the groundwork, find potential customers that will believe in you. And again, you need to get lucky and be lucky there. We found a very enthusiastic HR director at a hospital who was willing to give this unknown piece of technology a go, so that you have your almost like a patron, your sponsor there, in inverted commas, that would say, yes, spend your own personal savings on it and I will give it a go. So we gave it a go, and it started, it was very, very surprising. It started saving millions for the hospital. We thought, it would improve staffing, which it did dramatically. We're talking about 90-something% of shifts that were unfilled before suddenly got filled with a simple piece of technology. But it also started saving millions, not thousands that we had suspected. So we realized that we were onto something there. And then again, the rest is history.
I'm curious, what do you think the HR, and be honest and be frank, without worrying about sort of overselling yourself, what do you think the HR director saw? What was special about, what did you think they saw in this and they thought they'd give it a go? Because clearly before you got to them, you would have knocked, I suspect you would have knocked other doors, and the answer probably would have been no from other people.
Yeah. They saw the mock-up that we put together, and I think with a little bit of tenacity from either side, we were able to persuade them that this would be a good idea. And I think, you know, it's a no-brainer, it's a simple thing, you know, it's not anything that you can't that is intangible. You can see how, if I had a way to reach my doctors or a wider pool of doctors and let them know about my needs for shifts, then more might respond, right? It's a simple demand and supply kind of problem. So it doesn't take much for someone who's open-minded back then. Now everybody knows about this piece of technology, but back then it doesn't take much to imagine a path forward. So her name is Nikki, and we are eternally grateful for her contribution. She then moved on, but in life. But yeah, it takes a believer, really.
Yeah, I can imagine. What other challenges did you have? What kind of technical or logistical challenges did you find along the way?
Oh, plenty. I mean, you're a novice, pretty much everything other than CPR. so and, you know, any challenge, name it, it's there. You don't have money, you don't have the expertise, you have the vision, you do have that, and you have the dream, and then slowly you start gaining some of the skills that are needed. But yeah, no, a first challenge was not having the technology, so we had to design it and develop it. The second challenge was not having money, so we had to get investment.
Was it scary putting your own money in and not knowing whether this would work out or not?
Oof, good question. Yes, I mean, foolishly, no. Looking back, probably should have been. But I think, you know what, as medics, we're in a very fortunate position, or at least we thought we were back then again, that, yeah, you know, if it doesn't work out, I'll go back to medicine. It's a gap year. It never is a gap year. And, you know, you don't always feel comfortable returning back to, the highly specialist environment, or, you know, applying your skills as a medic. But yeah, I think that's why it wasn't that scary back then.
What was it like once you were starting to grow, and you obviously need a lot more money than you've got stored in the bank? What was it like? How does it feel asking? I know, and I remember that you went through a round of asking family, friends, and relatives as the next stage before you went out to, I suspect, to a sort of wider audience. Again, were you worried? Were you asking people to invest in something that you weren't quite sure whether it would pan out? Was that a challenge, do you think, or was it a natural progression?
Yeah, no, it's a very good question. I don't think it was a challenge, because when you're starting something that you truly believe in it, right? Whether it would work or not, you truly believe in it. So you do believe in it. And any investment comes with its own financial risk that people are willing to take, and you're not forcing anybody. But the benefit of getting a few early believers, in the startup world, you call this friends and family round, is that you get people that believe in you because they know you, to invest some money early, take a higher risk and invest some money early on, but they also get a higher return down the line. So they get the best deal out of everybody that follows. So, you know, high risk, high return.
Yeah. And how was it once you'd demonstrated this hospital that you could save millions, you could improve, you can reduce the number of gaps and fill them in? How did you scale up? What were the next steps? I mean, how easy was it to sell that to other trusts?
Yeah, initially it's not easy to persuade somebody who doesn't even know that this is possible. It takes a fair bit of persuasion, but when you have the data, the undisputable data, then it gets easier. But you do need the financial stamina as a young new organization to grow the team and bring experts in-house, experts that would, that know much more than you do on their discipline and help you grow it. So it comes with, financial modeling, it comes with predictions, and it comes, a sales team is formed, a technology team is formed, professional designers in-house to help with the development, operations teams, and you name it really, but yeah.
And tell me, how much did your medical degree, let's ignore, I know you did a specific degree sort of within management, but how much did your medicine and your medical degree give you skills to help you with what you're doing today? CPR clearly may be useful, but hopefully it will never will be in your workplace. What about everything, all the other skills, the soft skills?
Yeah, you say that, the other day, there was an accident just down the road here.
Oh, no.
I was within the radius, I was the only one who could administer some sort of basic first aid. But so you never lose those skills. But to seriously answer your question, way more than I had anticipated. Medics, and I'm sure other healthcare professionals, are so well trained and practice it on a daily basis to prioritize work. It's second nature, and actually it's not second nature for everybody, but for healthcare professionals it's second nature to prioritize work and deal with emergencies, again with razor sharp focus. I never realized how well engraved it is in a medic's DNA. And when you have an unbelievable amount of tasks to do and no clear path of how to get from A to Z, then those skills of putting, I still do this, by the way, your empty boxes that you half color in and then color in the other half, and it just helps you get to A to B. But beyond that, we've done that, and you do it more than I do, countless of times. So it's genuine second nature. So those skills are invaluable, and we have used our experience as medics to create protocols and put protocols in place very similar to ABCD when it comes, because we're a software business, and for it to function 24/7, you have to be able to also respond to anything that might cause it to come down, and how you do that fast and effectively. It's very similar to a patient that's arrested.
Mm-hmm. I mean, I'd like to say that we've moved on. It's in the years that you've been away from medicine, we've moved on from making boxes and taking them off and crossing them off, but we're still doing it. Some things don't change. And tell us, we've talked quite a lot actually about the idea and the challenges, but tell us about Locum's Nest. What is it now? How has it evolved?
Yeah, so since then we've grown significantly to have raised a few rounds of institutional investment, few £1 million that allowed us to grow the team. That team is now 25 people strong. It covers all disciplines that you'd expect in a software company. We are working with more than one trusts, quite a few actually, and over 50,000 healthcare professionals. We started with doctors, by the way, and since then we've rolled out to nurses and allied health professionals. 50,000 doctors and nurses and others that use our platforms on a daily basis to book shifts in their hospitals, in nearby hospitals, in GP practices, and in the community. That has, we estimate, saved the NHS. It's hard to quantify how many lives have been saved because you don't really extend beyond filling shifts, but we fill 95% of the shifts out there. But that also saves them in recruitment fees close to £500 million already. So lots of good work is happening by everyone in the Locum Nhs family and our partners.
Were you affected by the pandemic in any way?
I think we were probably affected in a couple of ways. Like any organization, we were forced to kind of go remotely. We were not strangers to that because we have a base in Cyprus and a base in the UK. But, there's a difference in working with others face-to-face and then going fully remotely like now. But also we were there when hospitals, the early days of real uncertainty, where hospitals were scrambling to reorganize themselves. We were there with the technology to fill those shifts until they could repurpose everybody and all their wards. We were there and we saw a huge spike in it. I think our medicine background also allowed us to quickly make the commercially silly decision to say we're not going to charge for anything that goes over expected usage. So we're able to help in as much as possible there. And then over time, as hospitals were coming out of crisis mode, again, we're able to help with analytics and again, knowing where the workforce is. I mean, it's ridiculous how, huge organizations like this might not necessarily know where everybody or how their budget is spent, but this is the case. So again, able to help in a wide variety of ways.
Do you see, you talk a bit about analytics and sort of people rostering and management. Do you see Locum Nhs expanding to provide some kind of consulting or in this kind of area? Or, I mean, do you see it changing other than beyond filling in shifts?
Yeah, no, I mean, it has changed. It has evolved since our early days, which was a simple matching software that said I had a shift, you have the availability, let's match. Now we do a whole variety of things, including business intelligence and analytics dashboards, and again help hospitals plan ahead. That is key. And we're not big fans of charging for things that others, hospitals themselves, can reach their own conclusions with. So with our dashboards, people in hospitals in management can make really sound decisions. We have a product called Community, which allows hospitals to reach out to their staff. Again, it's to somebody who's not, within the NHS, might not appreciate how detached the frontline team is from the management. So we're genuinely trying to bring them closer together with the ability to communicate via the app as well. And the other thing that virtually every single medic and nurse has experienced is the horrible sign-up process onto that staff bank. The dreaded endless paperwork. So we're streamlining that massively. So one of the biggest innovations that we brought beyond the initial one was the concept of collaborative staff banks. So if you work in hospital A and you want to work in hospital B, currently, if you don't have locum nest, you have to fill in the paperwork again. But through the technology, we've made it possible so that you can work anywhere within our network, within that particular network, rather.
Yeah, very impressive. I mean, I think all of us have gone through the sign-on process for multiple trusts along our careers, and it's the simple things, it's the small things, but actually they make the biggest difference in your working pattern. And having a streamlined process clearly makes a massive difference.
Oh yeah, it's yeah.
I know you've won a number of awards for Locum's Nest. And I believe one from NHS Innovation, or there's a technology department within the NHS Health Government Ministry. Am I correct in saying that?
Gosh.
Recognition, I think, from
yes.
in a while. I think it was quite in the beginning. So sorry to spin this on you. But
yeah,
no problem. The technology. There is a technology arm to the NHS, to NHS England, I think. Have you had much involvement with them?
Yes. So I think you're referring to the National Innovation Accelerator that we were a member of. And that is a body within the NHS that handpicks every year a few technology or innovations, rather, that they affiliate themselves with. And through that, you get some expert help within the NHS to help grow and, you know, put it in as many organizations as possible. But at the same time, you get real world external validation of your innovation. So there was a study, an independent study, that showed that for every £1 a hospital spends on Locum's Nest, they save 10 or something, again, crazy, which is not surprising, but it's great to see that external validation.
Fantastic. I'm going to pass over to Nicholas G, my co-president, to continue, but it's been, thank you for answering all those questions. Nicholas, over to you.
Thank you, Savvas. Nicola, amazing. It was great to hear all your answers. I'm just going to change the subject a little bit to the subject of living medicine, and how easy was that, or it wasn't easy. I mean, you mentioned already that you started Locum's Nest while you were an F3, so you were not sure. I mean, you still had medicine as a backup. If Locum's Nest wouldn't work. When did you make your decision to actually finish medicine?
Oof, again, takes me back a few years now, but it's one of those things that it kind of evolved as time passed. And I think unless you've been, and I might be overgeneralizing here, so do correct me if I'm wrong, but unless you've been unhappy for some time in your current post and have been brewing the idea of I want to change, then it's not a sudden move. And I was of the latter group. I was, you know, very happy working as a medic. Felt fairly stimulated. You know, I hated the night shifts like everyone does. Again, a typical medic there. At the point where I had to make a decision about my future early career options. And everyone around me was taking a gap year. I decided with Ahmed not to take a restful gap year, but to pursue this idea. And the biggest driver was that we would regret it if we hadn't. So we both decided there that we would regret it for the rest of our lives, and now is the point to pursue it. And yes, you know, as years pass, you look back and say, gosh, I mean, it's been so many years, and it has. It's been, you know, 7 years now almost. So you look back and say, oh, I didn't realize the time passed, especially if you're having fun. So you transition out of it. I mean, my GMC is still active, my registration for some reason. So in theory, I could return back anytime. But
all right, okay.
Yeah.
Amazing. I didn't realize that you still had your GMC. I thought you gave it away. Okay, great. And can I ask you, Nicola, how, I mean, when you made that decision, I mean, what was the reaction from your friends, family, even your sort of clinical supervisors? Well, I suppose you were out, you probably didn't have a clinical or educational supervisor at that stage, but what about your friends and family? How did they support you in that decision?
Yeah, no, I did have, I made the decision before leaving F2. So my clinical supervisors were actually very supportive, and which is very, refreshing. So both my educational and clinical supervisors were very, very, very supportive. My family as well, as they indulge these sort of things with me. Yeah, I think I was in an environment where everybody was fairly supportive, which again made it slightly easier to make that jump.
Absolutely. And Nicola, do you miss any of your medicine at all? And if you were to continue in medicine, what do you think you would have done? Medicine or surgery, and what specialty? If
gosh, I mean, that question gives me the palpitations that anyone goes through when they have to click that button and make that decision. But yeah, no, of course I miss it. Of course I miss the thrill of the action, but also the huge satisfaction of directly hands-on being responsible for improving somebody's life. But looking back, I do not regret for a single minute this move, not only because it worked out, but because I hugely enjoy what I'm doing, but also, as we discussed earlier, we're able to, at a massive scale, help the NHS.
Absolutely. Yeah. I mean, you're definitely 100% making a difference in a different way, and probably in a more even more valuable way. You've lived medicine, as a medic, and now you are involved with medicine through Locum's Nest. I mean, and you've seen the NHS evolving over the years. What do you think are the challenges faced by the NHS at the moment, and how do you see the future of NHS, especially having the pandemic as well, the last couple of years?
Yeah, well, a big question, a very big question. But without going into an endless monologue about it, I think its biggest challenge, as a kind of a general theme, would be staffing, and staffing not around a single point, but across the value chain of how services are planned, how aging population contributes to that, how the staff is distributed and reskilled to cover the needs of the service and any country, to be honest, as we progress across the century. But I think we all know how vital national health services to the well-being of the nation. So we can't give up on the NHS, despite its flaws, despite the drawbacks that a massive organization with the public, massive organization with the diseconomies of scale that it's seeing. Despite those drawbacks, I think it takes every every single one of us to spot those inefficiencies in processes, from quality improvement projects all the way to what we are doing here at Locum's Nest, government and beyond, to improve it. So now I'm really looking forward to the changes that are coming within the NHS. Honestly, I think it's going to transform care that other countries will emulate.
In what way? I mean, what do you have in mind?
Everything happens in such a massive scale that the whole world has its eyes on it.
Okay.
To spot and prevent issues. We make mistakes in the NHS, others don't. But also, things that we innovate around. So, I see the little area that I work in, which is workforce in the NHS. Huge innovation is happening in this space, and it is a problem. We are addressing problems that every single other country is facing, and not every single country is addressing as well. So watch this space.
Yeah, absolutely. And I suppose the answer is not to bail on the NHS, but it's just to have innovators like you and startups and new ideas to save the NHS, save money, and make it more efficient. And that's probably the answer, instead of moving to something else. That's amazing. I mean, in terms of the life of junior doctors and training, I mean, what are you thinking? I mean, what are the changes that might happen over the next few years with the changes of the NHS?
Yes, I can only, from the slightly detached point of view that I have here, I can only comment generally. And
it's got a very interesting perspective, though, probably in many ways better than ours, because you see things more with a sort of helicopter view. I think it's
no, you're right, and I've experienced the other side of non-NHS employment and non-NHS career paths, and I think the NHS needs to inject a little bit more compassion in the way it treats its staff than it does now. I'll give you a clear example that is kind of fresh in my memory now, that is happening now. You're applying for your ongoing registrar career, right? You're about to choose your specialty. You work your nights, your days. You are hardly given any leave to prepare for that application. There are way more applicants than jobs, and you're like, why? We're understaffed, and yet you have this issue. But at the same time, you apply, and they tell you you're going to hear from us maximum 7 days before your interview comes. And that is very painful to an applicant that's already overworked, that's already stressed, and has to go through that process of preparing to compete with their colleagues. So that's just a tiny example, Nicola, of what is a clear demonstration of lack of compassion in our processes within the NHS, and it takes a great initiative to change the status quo and go back and say, hang on a minute, why are we doing things the way we are, and why have we not kind of put more resources in reviewing those applications early, so we can give a breather to that poor registrar who's holding 15 different bleeps. So anyway, this is just an example where I feel strongly about, but there's so many others.
Yeah, no, that's. I'm glad you say that, and it's. I'm holding what you said, that the NHS needs to inject compassion. I think that's really important, and it's very good way to say it. We're coming towards the end of this discussion. I mean, Nicola, where do you see yourself and indeed Locum's Nest in the next few years, and so pragmatically, or even sort of your dreams? For the business.
Yeah, thank you for the question. So we are doubling down on our efforts to help as many hospitals as possible within the NHS. So we are constantly innovating and developing more services, more products, but also putting our software in hospitals, because I mean, this was created was born out of a personal need, right? So we know it's helping countless of lives of our colleagues to begin with, their patients, and then the finances of the system as well. So we are investing heavily in that effort. That will take us a few years, but you will see soon here Locum's Nest growing in that capacity. At a personal level, I think it's a huge personal growth to see that vision come to fruition and see that with colleagues, and that you work on a day in, day out, and treat like family. I take that journey with you. So I mean, I'm very excited to be part of this initiative.
That's amazing. It's great to hear that. And finally, there are medical students and junior doctors that are watching us. Some of them you may know, you may have helped in the past, and certainly there will be many people watching us over the next few days. What would you like to tell them? Advice, encouragement?
Yeah, I think it's follow your dreams, not others' dreams, your dreams, and not foolishly, plan ahead and do not take any rash decisions. Follow your dreams and not society's dreams. Your dreams. Again, I think that what matters, because if you're happy in what you do, then you will be able to produce the best results. If you have to change your specialty, change it. Of course, you're better off making the right decision straight away, but if you haven't, don't be afraid. If you have to leave medicine like I have, then do it. And I think I think medics are very good at supporting each other when it comes to this, because we've all kind of experienced these sort of things in one way or another.
Amazing. I think that's a great way to finish this. Nicolas, thank you so much. It was great. It was sweet and short, but it was amazing, and hopefully we can have more discussions in the future. I'm personally very grateful for your time. I do take a lot of things that you said, and I think you, in fact, with CMS UK, I think you've got things to offer to us as well, and it would be great if you were involved even more than this today. So thank you very much. I'll pass over to Savvas, and then thank you.
I just want to reiterate again my thanks for your time this evening and for the very useful insight. I was going to ask whether the grass is greener on the other side, but I think your last comment answers pretty damn well that question for everyone. So thank you again for your insight and for sharing your time with us. I know you've got a pretty busy schedule and a lot of traveling involved as well.
Thank you guys for having me. It's honestly a huge honor, and looking forward to our next one.
Thank you guys. Bye bye.